Okay, now I'd like to show you guys how to order labs, consults, procedures, and imaging. The easiest place to do this is under the Orders tab. There is a secondary option if you click on the Consults tabs. You can also place consults and procedures here as well. So we'll go back to the Orders tab. In order to order labs, you'll click on Laboratory menu. There's a lot of different options here. Many people over the years have used WX outpatient clinics, which is okay. It has a large number of the labs you would want to order. I actually prefer to use the primary care menu. So over here on the right, primary care menu, a little more extensive. It's also more organized and I think user friendly. So here on the far left, you'll see these will be mainly the labs that you'll be ordering, at least in the primary care clinic. So A1C, microalbumin, CBC, Chem7, LFTs, lipids, and then you can see some other options over here, some serologies, rheumatologic studies. You can order a UA. We do have colon cancer, the screening through something called the FIT test, the fecal immunochemistry testing, where you could order it through the system and then manually give it to them. Um, and the important thing to know is that if you don't see what you're looking for here, you also have the option to free text it. So if you click here under Other Labs, this is where you have the option to type in anything you want. So someone has transaminitis and joint pain and pancreatitis, and you think they have hemochromatosis, you could type in here hemochromatosis. You would hit Accept Order. You would hit Done to get out of here. And then once you see something in blue, that means that it's ready for your signature. So you would click on it and then you would right click and you would hit sign and then you would enter your signature code and then it would be active. So that's ordering labs. For consults, you click on service consults. This is a little challenging. It's not organized extremely well, but I would encourage you to sort of take a look, get your bearings. Uh, Chances are, if you do not see what you're looking for, many of the medical subspecialties fall under medical here. So medical Brockton slash West Roxbury. So if you click on that, you'll see you can order cardiology, dermatology, GI, palliative care, rheumatology, infectious disease, etc. Same can be said for surgical subspecialties. So if you don't see what you're looking for, you would click on surgical. You can see here thoracics, general surgery, neurosurgery, orthopedics, urology, plastic surgery, etc. I do want to bring your attention to two other things. One is called a non-VA consult. So if there's a service that the VA does not provide, within house, but we authorize it in terms of payment. You would order that under a non-VA community care referral. From your perspective, really the only two that you probably will be ordering, really it's actually only one now, would be massage therapy. So that is sort of recommended, approved by the VA, but we do not have a massage therapist in house. So you would click on community care and massage therapy. We used to refer people to the private sector for chiropractors, but we've actually hired one, so that's now done in house. The other thing I want to bring your attention to, one of my favorite things about the VA is electronic consults. So you can see here e-consults for all services. So an e-consult, it allows you to get an expert opinion from a specialist without the patient being seen in the office. So any question that you have that really does not give any benefit from the patient being seen in person and is a non-urgent question that could be answered, anytime within the next few days, that really sets the stage for an e-consult. So I use these all the time for various subspecialties. For instance, infectious disease. Let's say I get a urine culture and I'm not sure exactly what antibiotic would be the best choice. I would have the option to be able to ask this, and then I usually respond rather quickly. So those are service consults. Right below service consults is procedures. So this is where you would order cardiac outpatient monitoring, so either a 14-day patch or 30-day telemetry. You can also order a TTE. You can also order cardiac stress testing here. uh, pulmonary function testing. That's where you would order this as well. And those are the most common ones that you would order. There's also options to order under the vascular lab if you wanted to do ABIs. Okay. And then finally, if you want to order radiology, you would click on radiology ordering menu. And again, this is organized by radiology study. So x-rays, CAT scans, ultrasounds, MRIs are most common. You also do have the option of ordering, an interventional radiology procedure. PET scans, I think, unlikely, and mammography and bone density. I'll just show you, for instance, if you click on CAT scan, this is a list of the CAT scan options. If you click on MRI, same thing, MRI options, ultrasound, same thing, so on and so forth. The important thing to know in terms of telling your patients is um, X-rays are the only thing that are is the only radiology study that is self-scheduling, i.e., walk-in. So if you order an X-ray, the patient can go directly the same day, or if you're speaking to them on the phone, they can come in at any time to get the X-ray done. CAT scans, ultrasounds, MRIs, mammography, bone DEXA scans, those they will all be called by a scheduler. There is a number you can give them, but it's not necessary. They will be called by the scheduler. And that is how you order imaging, labs, consults, and service procedures.